Um, just so you know, Troy, there's a couple people ahead of you, but we'll go ahead now and start with Ralph, then Letty, then Troy, then Lolly.
Okay.
Okay, Greg.
Mhm.
The trees oil.
Yes.
Is that, I know we inhale that. Would we use that topically?
Oh, you'd use that topically. You could make a body tonic or an ointment. I find body tonics were good or just neat, like a
Okay.
few drops on. And the thing that's nice about that, I mean, that's another thing you could actually throw directly at the neck, but I'd also put it down like on the solar plexus area just so it hits the ribs.
Hmm.
Is it's reducing again the defense mechanisms, which is kind of what we're talking about with the adrenal support. But part of our defense mechanisms is that the fascia like tightens up, like
Yes.
it's not wanting incoming anything incoming to go deep to the bones or to the spine or to the neck. So in a way, the fascia kind of tightens up to try to splint an injured area, even though it might be 20 years old. It's like, well, if I stay tight, the neck won't move as much, and so then it won't hurt as much. But it's just a reaction. It's not necessarily a long-term strategy. And so the thing that's nice about the trees is it's kind of like the fascial release where you use it diminishes the defense mechanisms, and it helps to relax and release the fascia and calm everything down, and is also very fortifying. And so very fortifying to the nerves and things like that. And so even with what we're talking about here with the adrenal support, that could be a thing that you use with that. Like it would be good on the neck, the chest a bit, and then even down on the solar plexus or diaphragm area. It could be quite helpful. I mean, I put trees on 2 hours ago. Like, I was like, I'd been super, super active, and uh like my mid back was starting to feel wound up because I was like bending and standing up and then reaching. I did that for several hours, and I'm starting to not feel very good. And I put some of that on and just lay down and let my back rest for about 15 minutes, and I mean, night and day difference. And the trees aren't really like a pain reliever or an antispasmodic. I mean, it has all of that, but it releases the fascia and it diminishes the the defense mechanism. And reflecting on what was happening is I was pushing a little bit harder than I normally do, and
Yeah.
the defense mechanisms in my body was like, hey, slow down, turbo, calm down. Like you're getting a little sassy, you're gonna need to calm yourself down a little bit. And I was like, yeah, whatever, I'm gonna keep doing this. And then all of a sudden I hit this wall where I'm like, I'm not feeling so hot. Putting trees on pulled me right out of it. Pulled me right out of it.
So for someone that's had a recent injury of some sort, putting
Yeah,
the
yeah,
trees on.
totally. Yeah.
Okay.
Yeah, like your wife with the knee thing. Hey, how is her knee doing, by the way?
Her knee's doing very well.
Nice.
All the
I'm so
swelling's
happy to hear
down.
it.
She's got full motion back. She's
Good.
feeling pretty spunky about it.
Good, good, good.
She went to see her trigger point therapist yesterday,
Oh,
and
tremendous.
the therapist said you still have some swelling in the area, so have Ralph continue to put the oils on, but
Beautiful.
it's looking very good.
Good. I'm so glad to hear that.
Yeah, yeah.
Yeah.
Okay. All right. Well, Sam, I'm going to put in an order tonight. So, all righty. Thanks.
Hey, take care. And then I think Letty, is that who is next?
Yes. Hi, Greg.
Hee
Hi, Sam. Want to first of all say thank you for my gift that I got. Happy cord cutting, Sam said. Now, now I need to learn how to use it. Does it have like a particular name, or it's just what is it? Just
It's a knife.
Yeah,
Just
it's
a
just
knife.
a knife that
Got super charged up.
sat on a statue in a shrine for quite a while, and So it's
Wow.
supercharged.
All right. Thank you.
Thank you for
So
all
I
the
just,
work that you do, and help with the booklets and everything.
you're welcome.
Yeah.
So I had a question. I know, I think a while back, Greg, I had asked you about, I was telling you that Ruben, he gets a like a burning sensation in his jaws when the only time he gets it is when he eats and drinks an alcoholic drink together. So it's kind of, I guess, like TMJ. So did you say marjoram for that?
Marjoram, but the other thing that I would be like a little bit curious about is like sometimes that jaw thing can flare up because of a little bit of dehydration. And so, that it's with an alcohol, a little bit of alcohol. Like alcohol can be a little bit dehydrating. I mean, not massively, but if he has a bit of a problem there, I would try marjoram. But how we're even talking about like this adrenal support and the trees. I mean, it's helpful. Like the thing with jaw issues is it usually is. The body is in defense mode. And so even if you look at dehydration a little bit, that's still the body is in excessive fight, flight, or sympathetic nervous system activity. And so marjoram would help calm down and pull him out of fight, flight, and help tone up parasympathetic, which is rest and repair, and it's antispasmodic. But I would say there's still probably other things that need to happen, like the trees and vetiver along the base of the skull. And I like this idea of like maybe using the adrenal support to calm down his adrenals a little bit, and you know, um,
No, he probably wouldn't be up to like doing like a protocol. So just putting it on the wrist would be okay.
or which part?
For the adrenal, like if
Maybe internal, like have him take it internally. The wrist will do a little bit, but it probably won't do enough.
and the vetiver, like you said, along the skull, right? All along
Mhm.
it. Okay.
Yeah, on the base of the skull.
Okay. So, and I think another question that I had asked a while back was the like there's a lot of sweating, and you had said sage. Is that still like the case for him?
Sage can be, and we're still talking about him.
Yes.
Yeah, sage can be helpful, and then if it's a lot of excessive sweating like in the armpits and the palms and soles of the feet, cypress can be helpful. If the excessive sweating's like on the forehead or the abdominal area, like not the whole body, but just in those two spots, that's a disturbance in the autonomic nervous system, and something like anise or lemongrass, something like that would be helpful to balance those things out.
And the anise and lemongrass, would those be internally, or those could just
Internal,
be?
internal. Those would definitely need to be internal. Yeah. Does he have any heart issues?
Not that I'm aware of. He's been getting a lot of like heartburn lately, but not heart issues that that I'm aware about him now.
Yeah, the heartburn, is he getting like kind of like tightness in the esophagus, like when he's chewing food or taking something? Is it like really slow going down and feel like it's getting stuck?
Honestly, that I don't know. I haven't asked
Okay. I would ask him that, because again, that would be his body's in super fight flight. Yeah.
that. So, if it's in super fight
Yeah,
flight,
all,
then
all
it's
the same things we're talking about. Yeah. Yeah. We would just be evaluating how bad it is.
okay.
Yeah.
Thank you, Greg. So I have another question. I have a coworker that um has a daughter that she goes there to school where we work at, but
Mhm.
she's had suffered from like depression and like anxiety for a while already, but like he seems like he's really frustrated with her because like I don't know, like she does all these crazy things, but I'm just wondering like is she, because I think one of the days that it was time to go to school, like she was fine or whatever, but I don't know like if it's like the following morning or whatever, but she threw up, and then he's thinking like that she's making herself throw up so that she doesn't go to school because it's like a big dilemma for him, like trying to get her to go to school. Like she just doesn't want to go. Like she's always complaining.
How old is she?
She's like 15, I think 15, 16.
Hmm. Yeah, I'd probably start with tarragon with something like that and just calm the emotions and she probably at that age, hormones and school and being a teenager, there's probably a lot of ups and downs with the emotional body.
Mm-hmm.
It's just kind of will calm down some of those things and the effects of those things.
Okay.
Yeah.
Okay. And then another question I had was about his dad. He had asked me about if there was anything for his dad has kidney failure, and is there any oils for that, or it's mainly
Or
just
what is it?
kidney?
Oh, that's a rough one. I mean, your best bet is to give them kind of decent sized dosages of cordyceps, but that's a rough thing to treat.
Okay.
Yeah, like try the cordyceps.
Cordyceps.
Yeah,
Okay.
the tincture. Yeah,
Is
like two couple dropper fulls, like 2 to 3 times a day.
okay.
Yeah.
Greg and I had just had one more question on parents that come to our school, like meetings that have to have meetings with me. Is there anything I can do to like calm some of these parents down? They're not so not aggressive, but I'm just saying like they want like a little demanding, like they want to check like all the data of the student, all the work. I'm thinking, sometimes I'm kind of like just feel like it's a little bit too, they're asking for too much.
That's going to be a tough one to address. Just do things that are kind of relaxing and soothing in the environment. Like even just lavender and, just things that are soothing, calming, so lemongrass, lavender, mandarin, things like that. Just diffuse it in the room.
What if some of these people are over the phone?
Um, yeah. Yeah, that's a tough one.
That's a tough one.
Yeah.
Okay.
Yeah.
I did have a kind of an advocate that did come in she came in kind of like a bulldog, but I'm thinking we're not trying to hide anything. We're there for the same thing. We want, everything, the best interest of the students. But sometimes they're just a little too demanding. It's a little overboard. But
Yeah.
okay. But I'll try at least that. Thank you so much, Greg.
You're so welcome.
Thank you.
And then go ahead, Troy, then Lolly.
Hey, Troy.
Hey y'all, how you doing?
Doing good. How about you?
Doing okay. Just want to say first of all, thank you for the personal blend.
Oh, good.
I got that and
How'd that treat you? Good?
smells great.
Yeah.
I just so far have just kind of like breathed on it a little bit, but is there any particular pattern or way of using it you'd recommend?
Yeah, was it on the card or in the email?
Yeah, we give a little postcard.
Oh no. Okay.
Yeah,
I
it's on the
sound
postcard. Yeah.
okay. I must have missed that. Okay.
And if it's in the
Uh,
trash, just let me know. I'll email
Yeah.
it to you. No problem.
So if I remember right, it's the heart, forehead, and back head, all three at the same time.
Forehead, back head. Okay. It's
It,
probably.
Samantha tells me it's longer, but
I could be wrong.
yeah,
I'll look
that's
through
the
my
gist of it.
I'll look through my stuff and find it, and if not, I'll email. Um. Anyway, thank you so much for that.
You
Other
so
than that, I was just gonna ask, like, kind of do a check in with, like, my shoulders still hurting a lot, and my elbows, same thing, and I'm just feeling like kind of
and have you been doing work on your neck? Have you been doing?
yeah. Yeah, I've been doing all of it, and I've been doing additional things too.
And has that changed at all, or?
No, go ahead. Try again, Troy.
Yeah, we didn't hear a response.
Oh, okay. Sorry. I
There you
think I
go. There you go.
accidentally muted. Can you hear me now?
Yes.
Okay. Yeah.
So
So
with treating the neck, has there been any shift or change in the?
there has. It's just not lasting, and I'm just feeling like pretty high levels of pain, feeling like weakness in uh, particularly upper body joints, but like, kind of stiffness and weakness sort of almost all over. And
Did you just do the org programming with the adrenal support?
I did, and I felt like a little bit calmer and stuff. I didn't notice a significant change um, in the upper body joints. There could have been some. I just wasn't maybe enough that I was like, oh, that feels way better.
And do you use marjoram very much?
Oh, I like practically drink this stuff.
Okay. So boy, it still looks like your body's in pretty strong fight flight.
Yeah, I'm like just kind of confused by it and starting to get like a little bit of like the, kind of paranoia about it. Starting to kind of worry about it a little bit. And I've actually been like taking time off from work and had like a overall much lower uh stress kind of lifestyle this last month, and yet uh I've been my body has been acting as if it's the opposite, as if I've added more stress.
Huh. How's your sleep?
Or as per usual.
Yeah. Let's do an experiment of like over the next few nights, and then maybe we'll talk later at towards the end of the week. But as you go to bed at night, let's have you um, use Palo Santo.
Okay.
Inhale it into your body, into the different areas, but then do that pattern of Mingmen, back heart, and crown, just like
Okay.
over and over and over again.
Okay.
Like almost to the point, like if you lay down and you start doing it, like, breathe it into different parts of your body, but keep doing that Mingmen, back heart, crown until you start to fall asleep. Like, let's just see what that does over a couple of days.
Okay. Doke.
Yeah, because like for whatever reason, boy, your body looks like it's in super fight flight.
Yeah, and
I
it's
mean,
like
that could be the pain. Like that's the thing is like, is it causing the pain or is it because of the pain? And at some point, it doesn't matter.
yeah.
It's just that it's there. But pain will definitely do that. And like you said, you're taking time off and it almost is having the reverse effect. That's a little bit like when you have a pain syndrome and then you lay down to go to bed, you don't have the distractions of the day and it almost becomes worse.
Exactly.
And so I would say experiment with the Palo Santo that way and mugwort. Like do mugwort, inhale it. You can go back and forth between the Palo Santo and the mugwort. But the mugwort I'd breathe into like the joints, the neck, the arms, the spine, like breathe that in there. But the Palo Santo, that pattern up the back, Mingmen, back heart, crown.
Okay.
Yeah. Let's have you do that for a few days, and then at the end of the week, we'll talk, see how that treated you.
Will do. Thank you so much.
And keep using the marjoram.
I will.
Okay, good.
Okay. Thank you.
And then I know, guys, I just want to give everyone a kind of a idea. We do have a hard out at 8:15 to go
Yeah.
to the Star Blessings. So Lali, Priya, then Emiliana and Danelle. And if we don't get to your questions, like the ones you posted in chat, please email us and we'll do our best to get to
Yeah.
everybody here. So
Yeah.
Go ahead, Lolly.
Hey, Lolly.
Hey. Wow, so many things, but okay, let's see. Let's connect it for a second to what we just talked about. So if we're talking about, all that's going on here in LA right now with all
Oh
the
man, it looks
fires
crazy
and
on the news. Like it looks so crazy on the news.
yeah, so it's it's a constant stress situation. So really when dealing with something like, trauma, whether it's, Israel and the alarm goes off, or whether it's, right here with all that's going on. So usually my go-to would be tarragon. But now I'm kind of thinking, what would be the difference? Like maybe adrenal support is actually a better
You could do
option.
adrenal support, but like what I would do like for something like that is like you said, you just came back from Israel where you're in a war zone and now
Yeah.
you're in a different war zone with all the
Mhm.
fires and stuff, which is nuts. Is I would do not just tarragon, as I would do the PTSD support or the program. So tarragon, then rue, then hyssop, and then splendor. But we were even talking about this because we're wanting to kind of send some things out to people on the West Coast, and I have some firefighter friends, and then just the
Mhm.
students, and it's just nuts. And so we're talking about like doing the PTSD kit, but then adding like the adrenal support as the program for it.
Okay.
So you would still do the PTSD part, but
Mhm.
you would add the adrenal support, and you would add I mean, I would probably do some form of like spikenard or myrrh or galbanum or red myrtle, violet leaf, like on the pattern of the brain, then spine, brain soles of the feet. And the idea being that you're calming down the spinal thalamic tract, which is how you process pain and how you process stimuli in the body and from the environment. And I would say that with everything going on, that's probably super over agitated, super, 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 overstimulated. And so spikenard on the feet. But I mean, you're still in an active situation. So it's not like, okay, it's over, let's
Yeah.
rest and recover. You're like, okay, let's rest, but you gotta watch the news and wait for, is there going to be some sort of an alert in the middle of the night for me to get out of the house, like so you gotta keep yourself as calm as possible until it's over, and then deal with the aftermath. And so again, I would go to those things, but until the fire's completely like resolved, it's going to be hard to pull yourself completely out of fight flight. It's
Yeah.
just marjoram would be another thing. I mean, I would just you know, surround yourself with all those things and just, just kind of keep going at it with all of that stuff.
And then when you're doing the PTSD support, I mean, it's all inhalations, but then internally you would do what? Tarragon and adrenal
You
support?
could do tarragon, you could do spikenard, you could even do marjoram.
You would basically do all of them.
Yeah, like the thing with like spikenard, vetiver, valerian, they're going to be some of the more relaxing things. But the thing that I would also throw in that mix is galbanum, because galbanum is about like physical pain, but like this is still kind of a pain that's coming from the environment. It's you're being super overstimulated by something that is out of your control, and it's not how you would traditionally think of pain, but it's still like a painful stimuli. You know what I mean? It's
Yeah.
and so I would do all that. Try to keep the breath deep, and there's got to be like crazy amounts of ash and toxicity in the air. Even just simply eucalyptus globulus inhaled for not for so much for the anxiety and stress and all that, but for lung function, especially to smoke exposure. Just the good old fashioned eucalyptus globulus is really super good for that.
So you do globulus and not radiata for that.
What's that?
So you would do eucalyptus globulus, not the eucalyptus radiata.
Radiata would still be good, but globulus would probably be a little bit better. But if
Oh,
you don't
okay.
have it, then use radiata.
No, I have them. I have it at least at one of the kits. Then it's fine. Yeah. Okay. So that one is better for the breath. Okay.
Yeah, I would say radiata is a little bit softer and a little bit more refined and a little bit more polite, where eucalyptus globulus is very very to the point. You know what I mean? It's not as refined, it's not as soft. It's about, kicking in the door, trying to clean things up. And for all that smoke exposure, plus there has to be just toxic things in the air. Gas lines rupturing, batteries burning, all those kinds of things. Like I would keep cleaning up the lungs. Yeah.
Okay. So then the other thing that also relates to that is really if we're talking about all those toxic things, if you need to do like some sort of like a detox, what would you?
I would do it after the fires are out. Like right now you're trying to survive the situations. You know what I mean? Like after it's all said and done, then we'll evaluate and have you go through and do like some detox. But right now, just like the globulus and all those other things, you got to keep your body as calm as possible as you get through this. Then afterwards, I'd go through and look at the detox and all that.
Okay, and then the eucalyptus, so you would do inhalations, diffuser.
Inhalation, I'd put it on the chest. Normally, I wouldn't say put eucalyptus globulus on the chest because it's so strong, but for this, I would. I don't. I put it on my feet. I put it on my abdomen. I would use it quite a bit.
Okay.
Yeah.
And then to deepen the breath, so really work with
out the PTSD thing.
Do that. Okay.
Just use the hyssop. Yeah. I mean, that's what the hyssop's for in that.
Right. And then the respiratory blend from the org programming, the stress, pulmonary stress support, use that as well. Kind of.
Yeah, if you have it, I would use it.
Yeah, I have
sure.
org programming. Yeah. Okay.
It's not going to clean the lungs up quite like the eucalyptus because like you're cleaning something up that's like physically there. The pulmonary stress support is about like the respiratory tract having difficulty, your stress levels in the body and things like that, which is true. You do have that, but I mean, number one thing is you have toxic things in the air that you need to make sure that your lungs just aren't getting all gunked up with all those things going on.
Okay.
Yeah.
Okay. And then let's say you're doing work with somebody who's been through like, losing everything, all the trauma and everything, then you would work the same way and you would add
PTSD. Yeah, PTSD.
Okay, so you don't even need to add any more emotional stuff.
PTSD kit. I mean, eventually, but right now, PTSD kit.
Okay. Okay.
Like
Which I have these.
That's exactly what that's for.
Okay.
Yeah.
Perfect. Okay. And then
and also like if there's people that like submit their names to Astara for the prayer petitions, we have people doing healings. I've even pulled in some other people to do healings, so we're doing extra prayers, extra healings. So anybody just submit their name and we'll do the best that we can.
Okay. Thank you. Yeah, because I'm taking care of myself and at the same time, I'm taking care of other people.
Yeah.
So, which is why I need to make sure that I'm good to be able to give to others. Okay. Thank you. And then I guess I have one more second. Pain, which is moving to another direction for a second. By the way, also as far as like skin concern, that's related to stress. You would just treat the stress, not really.
I would treat the stress right now.
Okay.
Like again, the skin I deal with like
Yeah.
after.
Yeah. Okay.
Yeah.
And then just a quick question that's not related to that. Pain on the right top hand. It's been going on for a few weeks now. I wake up with that in the morning. It happens during the day. So it's it's not an injury. It feels like maybe a tendon or a muscle. I've been using some joint relief.
Mhm.
Not sure if I need to switch and maybe do the
I would
tendonitis
probably start
blend.
with like pain soothe or nerve help, but I would treat it from the neck all the way down, like the shoulder, the arm, heavy on the forearm, and then the hand itself. Like treat it all the way down.
Okay. And then do like ointment or body tonic type of thing.
Yeah. Yeah.
Okay. Okay, so from the neck down. Okay. I have more questions, but I'll just stick to those today and let's
Okay.
you have a few minutes. Thank you so much.
You're so welcome.
Thank you guys for being so considerate. And go ahead, Emiliana, then Danelle, if we have time.
Hi, how nice to be here. And thank you so much for everything. Two quick questions. I have a patient with a pretty strong case of receding gums, and I wondered what you would recommend for that.
Cypress is usually what we use for like receding gums. Like any sort of gum issue, especially if the gums start to get a little bit spongy and things like that. So you can have them just take the Cypress and put it on their finger and then just kind of rub it on the gums. But I would also have them take a couple drops internally.
Okay, would you recommend that like twice a day internally?
Yeah, twice. If they would do twice a day, that would be amazing.
Okay, like two
But
drops?
at least once a day. Yeah.
Okay, so 2 drops twice a day internally and on the finger and rub it on the
And
gums.
then just keep rubbing it in on, yeah, it's perfect.
And my second question is, often when I am needling an injury, working on an injury, I'm noticing that patients are clenching their hands, and I know that that's a defense. Like they're bracing for the pain, but often there isn't
Right.
any because I've used nerve help or I've used arnica, I've used
Right.
like something on it to help. And I've used the health rays and to expand the area before I'm doing the needling. But I'm wondering about this is the first time I've heard of the trees oil.
The trees blend, and you know what might work for that as well, because some of that is anticipation, but some of it is also the pain itself. So the trees might be something that you could explore, but galbanum, which is in the family of frankincense, it really diminishes the pain sensation. One of the things that I used to do, like in person, is before I'd introduce them to galbanum, is I'd have them take their pen and press on their nail bed or poke their skin and go, okay, see how that feels. And then I'd have them inhale galbanum or put a couple drops on their wrist and then go back and apply pressure to the nail bed or poke with the pin itself. And you feel pressure, but you don't feel pain. And I think, the combination of doing something like that, you can have them inhale it, put a few drops. It doesn't even have to be near the area. It can just be like on the wrist or something, or, you rub it like in their temples or something. And they'll start to have the experience of like, hey, it's not as painful as I thought. And eventually, the combination of diminishing the pain response and them having a couple of experiences where it's different, it should calm that down. Yeah, it should calm that down.
All right, that's what I've got tonight. Thank you so much.
You're so welcome. Keep us posted. Let us know if we can do anything for you.
Thanks, I will.
So we need to jump over. I'm so sorry if we didn't get to your question. Please email us and I'll make a point to answer them, in the morning or tonight or something. And so sorry, but
But right now we are headed over, we're doing special blessings tonight. So it is blessing the Astara healing and prayer petitions, but it is also all week for Astara, we're doing special blessings and for the
For the
fires.
fire on the West Coast. Yeah. So please join us if you can. Like they could use all the blessings we can give them. So thanks, you guys.